All right, so today we are talking about facial balancing with fillers. And our beautiful young patient here, 37-year-old, has a long history of smoking, right? So how long was that?
From the age of 15 until a few years ago.
So age of 15 till a few years ago, I'm not doing that math, but it's long, and we know the implications of smoking on the skin. And so what we want to do today is start to restore and refresh her appearance, and we're going to use fillers in a couple key areas to really hone in on the facial balancing. So when we look at other people, there's certain things we intuitively or subconsciously seek out or admire about people based on certain proportions. And the easiest way to think about this is facial thirds, both horizontally and vertically. And so when I look at a patient, I'm doing a quick assessment. What are the thirds of the face doing in both the horizontal and vertical direction, and trying to harmonize that look to get a more aesthetic outcome. And so our patient here, and you've lost some weight recently as well, right?
Yes.
So we talked about that. That's a big topic right now, is weight loss. A lot of people are losing a lot of weight with certain medications, and that's awesome for them, but it's having some aesthetics implications on their appearance. We can balance that back out with filler. So what we're going to do today is just a quick assessment. So if I'm looking at my thirds of the face here, one of the things that stands out is the temporal hollowing here. So temples are a widely underserved area in facial aesthetics that can really, as a simple procedure to add a quick rejuvenating look to the skin. So we look at the temple here, we see nice hollowing here. What happens is as the temples atrophy and waste away over time with age, with weight loss, whatever, with smoking, is you start to get a skeletonized look. So you start to look more like a skull. And so we don't want that. We want a nice full temple. We don't want over full. So just looking here, we can do definitely some filler here. Maybe turn it just a little bit. And so you can see how this is sunk in. Now when we look at other factors in the face, like the OG curve, we do want some transition between the temples and the zygomatic arch here, and then down here into the inframalar region, but we don't want it too hollow. So we're gonna treat this area today with a little bit of filler here. Looking here, the nasolabial folds. This is the big area of contention for patients. They're always talking about nasolabial folds and filling that back out. Now what we wanna do, nasolabial folds are very natural to have. We don't want to eliminate those and get a big puffy mid face. We want to soften that transition here. And then down here along the mandible here, as we're starting to get past the prejowl sulcus, in this area where we find the marionette lines, we have a little bit of wasting in here that's starting to create that marionette line coming down and giving us a transition point for jowling. And so we're gonna fill this area in here just to balance the face out. So I always wanna know where the tip of my cannula is, and I don't wanna force anything through here. If I get hung up on some connective tissue, just redirect your needle, or your cannula, around it. When you force through tissue, that's when injuries are more prone to happen. Because even though this is rounded and flexible, it's still rigid enough to cause vascular injury.